TRT, or testosterone replacement therapy, is going to be giving the patient external testosterone in order to optimize their own testosterone levels. So that's going to be very important as men go through life and they're aging. Their testosterone levels are going to start dropping off. For a lot of men, it's starting to happen after 30. Every year, it kind of starts to trickle down lower and lower and lower. As a matter of consequence, how this makes you feel, generally speaking, patients are going to feel like they have less energy, like they're not able to build muscle as easily, like their motivation has decreased, their libido decreases. And so for quality of life, people start to experience that things start to really shift and decrease. And this is an easy way for people to really get back a lot of their quality of life. But doing it in isolation is not always going to be the best way. So not just doing testosterone. We want to look at not only the testosterone itself and the free testosterone, but what do the patient's estrogens look like? What do their dihydrotestosterone levels look like? What do their sex hormone binding globulins look like? All of these things are going to have an important effect on what the testosterone is actually going to do for them once they actually start getting testosterone injections or testosterone cream. Because a lot of people will start taking testosterone and they'll convert the bulk of it over to estrogen, and they end up feeling worse. So the enzyme that's responsible for that conversion is called aromatase. We want to make sure that that aromatase function is being downregulated. And we can do that through supplements, through natural means, or we can do it through pharmaceuticals at a very low dose. And so if we recognize that problem right away before we even start treatment through lab testing preliminarily, we'll be able to see, okay, this person is over-converting towards estrogen a little bit. Let's dampen that pathway and boost up their testosterone. Then we can give them little bits of testosterone to even pump that up a little bit more so that they're feeling optimal. Same thing with dihydrotestosterone. A lot of men are converting their testosterone towards dihydrotestosterone. That leads to male pattern baldness. It leads to a lot of prostate issues, prostate inflammation, getting up in the middle of the night to urinate frequently. And so again, we can take botanicals, we can take pharmaceuticals, and we can dampen that pathway as well, or both. Some people have overactive conversion in both pathways, so that we can make sure that the intended target, the testosterone itself, is actually coming up. The other complicating factor here is a protein called sex hormone binding globulin that's primarily made in the liver. This binding protein is going to be binding up all your free testosterone, estrogen, and dihydrotestosterone and not allow it to be expressed. So essentially, it's grabbing onto all your free hormones and kind of trapping it to some extent. This usually starts to increase once we start giving people any kind of external hormonal supplementation, whether it's somebody getting estrogen creams or testosterone. It's going to start to steadily increase the sex hormone binding globulin. So we want to monitor it, and we want to do things to try to get the liver to be able to detoxify so that we can lower it back down to normal level so that they actually have free expression. So for a lot of people, we see, okay, their total testosterone looks excellent, but for some reason their free expression is super low. And it's usually because this sex hormone binding globulin level is so elevated. There's a number of things we need to juggle and a number of things we need to look at simultaneously to be able to appropriately give testosterone therapy. It's not enough to just look at somebody's testosterone, and it's not enough to just give somebody testosterone injections or testosterone cream and say, okay, great, have a good time, we'll check back in on you whenever you feel like it. We want to make sure that things are optimized, and once they're optimized, we're rechecking every 6 months. Everything's on track, good. We can keep pushing it out maybe once a year after that, but it needs to be checked diligently so that we make sure that nothing is going awry.